Welcome to this Police Care UK webinar on stress, and specifically stress in policing. My name's Stuart Amos, and joining me today is Police Care UK's Psychological Services lead Adam Getty and registered mental health nurse Lucy Hastead. Now, hello guys, how are you?
Morning.
Stuart.
Good, thank you.
Delighted to have you with us. Now, we're here to talk about stress and particularly how it manifests in policing. Now, to give some context, I'm just going to share a statistic with you that really is quite surprising. Now, in 2023, 14,500 UK police officers were signed off work due to stress, depression, anxiety or PTSD. Nationally, this figure is 9% up on last year and a staggering 130% higher than when the survey was first run 11 years ago. First of all, let's to start with, what is stress? Adam, in your professional opinion, what is stress and what do people need to look out for?
Yeah, really good question. And first of all, a certain amount of stress is necessary and it's even helpful for your functioning. So I remember whenever I first started at Police Care UK, I said, never ever give me a task and say, just get that back to me when you can. Give me a deadline. So I need a deadline. I need a little bit of stress to help me function. And in small doses, stress can help you stay focused. It can help you remain energetic and alert. But when it becomes overwhelming, it can start to damage your health, your mood, relationships, and your quality of life. And I suppose the real issue is that whenever stress turns into distress, and in sort of a typical average work life, we spend about 100,000 hours of our life at work. So it's really important that we address this so that we can turn work into a more satisfying and rewarding place to be. And workplace stress can affect us emotionally. You can notice an increase in your emotions such as fear, anger. A lot of people can feel it physically, such as muscle tension, stomach pain, tightness in your chest, tingling sensations. But it can also affect the organizations that we work for too. And it's estimated that around 40% of all sickness absence is due to stress-related symptoms. And that's staggering. And then there's the domino effect of this, that stress at work can also result in increased staff turnover, recruitment problems, low staff morale, and reduced productivity, something that we're seeing a lot of within the policing populations. But in general, I mean, we all respond differently to stress.
You talk a lot about the symptoms there and what people experience. What are the risks of leaving stress unchecked? I mean, I'm guessing stress can be a gateway to other mental health issues. Is that right?
Yeah, absolutely. I mean, from a physiological perspective, it can result in increased cardiovascular issues, increased blood pressure, poor sleep, muscle tension, grinding teeth. It can have an impact on the brain and structural changes. So in fact, your hippocampus. So chronic stress can reduce the size of the hippocampus. And this is an area of the brain that's crucial for learning and memory. It can result in amygdala growth. So the part of your brain which processes fear and emotions, this can become enlarged, and it can make people more sensitive to stress, increasing their anxiety and aggression. And if this gets left unchecked, it can sort of become quite chronic. So people can develop things such as depressive symptoms. If they're feeling unhappy, they can develop anxiety problems such as generalized anxiety, increased worry about worrying. So there can be this real domino effect if this gets left unchecked.
You can see how it can snowball out of control, really. It's quite easy to let stress dominate your life, I guess. Lucy, what are you seeing on the on the front line as our registered mental health nurse here?
So I think overall we've seen an increase in the policing population coming to us being unwell both physically and mentally due to work-related stress. And it's not always about the day-to-day issues that we would assume people are particularly struggling with, such as traumatic incidents. There's a lot more goes on. So it's there's a lot of people coming to us talking about organisational pressure, the day-to-day pressures and key stresses that people are trying to navigate. A really good example was coming in day after day and there constantly being a backlog to work through. You're then taking that next day's tasks on, and it's an ever-increasing circle that doesn't really seem achievable, which then increases the amount of stress that somebody is perceived to be under. And I think trying to keep on top of that, taking on additional workloads, it all has this combined effect on somebody's well-being, be both the physical and the mental health. There's certainly something that's come up more and more in conversation is people taking on more duties to cover sickness, other people's absences, vacant posts that aren't being filled and are just being left open. So that lack of resource is leading to these potential feelings of people being stressed and overwhelmed, and to the point of exhaustion with the sheer volume of the work, not just the content of the work that they're actually dealing with. And I think there's other things to take into consideration as well when we're talking about things that people are approaching the charity for support with. There's things that are potentially outside of work as well. And I think the thing that we're coming across quite a lot is the cost of living at the moment, and those increased pressures and people feeling like they have to take on more shifts to be able to pay for those extra things. That knock-on impact on your family, your friends, your loved ones, that those relationships that we hold closest to us. Actually, what we're seeing is that people are pulling away from those loved ones, those colleagues, those friends, because they're feeling so overwhelmed. Whereas actually, it's probably one of the worst things to do is pulling away from that potential support from those around you, and your work colleagues as well. It then interrupts things in the family life, the impact on your loved ones, on your children. So it's all of those combined, it's got the potential to be very disruptive to a person's life and quite impactful.
Now, Adam, I'll just bring you back in here. It's you were mentioning there's sort of 3 common responses when we're overwhelmed by stress. What are they? I mean, this cumulative picture of stress at work, stress at home, and coping with that. What are those common responses?
Yeah, so I mean, everybody will respond differently, but the 3 common responses whenever we feel overwhelmed by stress are, the first one is the foot on the pedal, and that can look like sort of being angry, agitated, overly emotional. And just like what you were saying, Stuart, lots of little things can happen that will fill up your bottle, that will cause you to feel overwhelmed, and then we respond in such ways. The second can be the foot on the brake, where we shut down, we space out, and we show little emotion. And we're hearing that a lot as well from officers, where they say, I feel the only real emotion that I show is anger. Everything else I feel numb to. So they're putting the do not disturb on. They're trying to avoid people because they're worried that they'll snap or become irritable towards them. And then the third response is to put on both the brake and the pedal, where people can feel tense, frozen under pressure, and just left feeling like they're unable to do anything.
What steps can officers take to begin to break this cycle of the loop, I guess, the loop between stress at work and taking that home with them? What can they do to break that cycle?
Yeah, well, you're quite right. It's about breaking the cycle. And there's an old quote by Henry Ford that says, if you continue to do what you've always done, you'll always get what you've always got. So doing nothing will probably change nothing. And one of the things that we're trying to do, that we've been doing for years, is that we're trying to address the stigma around mental health, that it's a sign of weakness. And, to me, it's actually a sign of strength, that you're asking for help. If you break your leg, you're going to go and get it treated. If you break your leg, you're not going to decide to run a marathon tomorrow. So why should mental health be any different? The things that you should be doing are, accessing support. One of the most common coping mechanisms with anxiety is avoidance. So it's about trying to re-engage, try to reclaim your life. But use mental health professionals. Contact your GP for a referral to NHS talking therapies. your occupational health referral pathway to psychological therapies, and of course, you can always contact Police Care UK for an assessment and then hopefully treatment.
Just want to share this with you really. Between April the 1st, 2024 and March 31st, 2025, 70% of those coming to us for help reported a primary need for mental health provision. Now, what does help with us look like? Briefly, what's the process? What can they expect to receive from us?
So the process for getting support through Police Care UK is quite straightforward. It's a referral on our website that's then checked by somebody in the clinical team. That's then allocated to one of the team members, so that be myself or Adam or one of the other team members, and then we would arrange to complete an assessment with somebody. So that assessment takes into account a lot of information that's current, some historical. We have very good conversations around what's been going on, the impact of that on that person's life, and then if we can support, then we can do an onward referral for therapy. So that is a short-term intervention of therapy that's provided by the charity at no cost.
What other things could people be doing before they get to that stage? Is it a case of taking time out or perhaps boosting mental health through exercise? Is that something that people can be doing, Adam?
Yeah, absolutely. So whenever I work with individuals, I use a traffic light system, and I say, well, whenever you're in green, that's you operating at full capacity. What does that look like? And then if you slip to amber, that's maybe the wheels are starting to wobble, and then red is we're in a really, really bad way. So we'll ask questions around, well, what have you done in the past that's helped? And for me, just like what you said, Stuart, exercise is big. It's really, really important. Love playing football, golf. But even that social connection is really, really important. So I try to break it down into 3 areas, and you can remember this as ACE, ACE, getting some form of achievement, getting some form of closeness, human interaction, and then getting some form of enjoyment, pleasure, hobbies, activities, things like that. And that can give you a good foundation to build upon.
I really like that. Now, what are the benefits of tackling your stress?
Well, I mean, who wants to feel stressed? Not me. Who wants to have poor night's sleep? Definitely not me. So, what we hopefully want to get out of this is that the individual has achieved their therapeutic goals, whatever they might be. But generally speaking, we're looking for a reduction in anxiety. And if you imagine your brain's like a computer hard drive, whenever we're anxious, that anxiety takes over a lot of that hard drive. So if we reduce the anxiety, we have more space where we're able to retain more information, we're able to be more productive, we're going to be less snappy, irritable, so the guilt is going to reduce, and then we're going to feel like we're able to engage with society again. You'll have improved relationships with others because you'll feel like you can be around them, you'll have better quality of life, and then even in your role, if you're less stressed, you're going to be a little bit happier about going to work, you're going to be engaging better with your colleagues, which will boost their morale, and then you're going to be engaging better with the public, which will then have that domino effect as well in a positive way.
And Lucy, do you echo those thoughts? Is that what you're telling people on the phones?
Yep, absolutely, completely agree with Adam on that. I think there's so many benefits to actually acknowledging, first of all, that you maybe need some support, but also then taking that matter into your own hands and doing something about it that is productive, be that getting professional support, be that looking at what you can do yourself. Overall, like Adam was saying, we're trying to reduce those symptoms and improve that quality of that person's life, and also including improving their health. We've talked about the risks of what stress can do if left unchecked. Actually, what we want to do is try and reduce those potential risk factors for somebody if the stress is left unchecked. So, as Adam was saying, getting a good night's sleep, we all know what we're like if we don't have a good night's sleep. We're a little bit irritable, we're crabby, we feel tired, we're not really engaged with the day. Whereas actually, if we can go to bed and feel refreshed when we wake up, we're more likely to be engaged at work. We we're paying our concentrations better, our moods better, it improves our relationships. So it's a win-win when these things start to improve, not just on your mental health but also your physical health as well.
Yeah, it's interesting, isn't it? A lot of things you mention here sound a lot like common sense, but at the same time, you often need to hear those words to say that I need to take action, isn't it? I think is one of these two things. So I think overall we can look back and sum things up by saying we need to recognise stress, we need to identify and adopt strategies to manage that stress, and overall the goal then is improving your well-being. Is that what we're saying?
Yeah, absolutely.
Yeah, exactly. A really good summary. Yeah.
Yeah.
Okay. Well, thank you very much for joining us. It's been a great little session.